it's been really scary. It's been really confusing.
Blood clot expert Dr. Manika Pai knows her patients and many Canadians have questions about vaccines and blood clots. She says everyone should still take the first vaccine they're offered, and she tells that to her own patients.
People who have a history of blood clots are likely not at an increased risk of this rare event, but they certainly are at an increased risk of adverse events from a COVID-19 infection.
Pai wants people to know the vaccine safety system is working and doctors are ready to help.
We feel confident that we can diagnose and treat it. So even though the information is changing rapidly, we are here and we're ready to protect you.
People may be tempted to wait longer to get vaccinated, hoping they don't get AstraZeneca or, when it's available here, Johnson & Johnson.
There's a real danger if you wait for 2 days in Toronto, for example, then you've automatically exposed yourself to a risk of death from COVID that exceeds this very rare risk of a blood clot.
Whichever vaccine you are offered is going to be the right one for you.
I think we can definitely be doing a far better job.
Scientist and science communicator Krishana Sankar says the desire to shop around for vaccines comes from fear.
Instead of, making people feel panicked and fearful, we really need to go in with being empathetic, number one, so that we show that, yes, we do indeed understand that there are safety concerns. But number two, we really share and look at the data.
Canada's top doctor acknowledges many Canadians have questions. The government is trying to provide healthcare workers the tools to answer them.
There is more to be done, whether it's through social media and other channels, to reach the younger age groups.
Vaccine hesitancy is often on the agenda in talks between the Prime Minister and the provinces, but with a second vaccine flagged for rare clotting concerns comes a bigger public relations challenge. Abigail Bimman, Global News, Ottawa.